Thanks. Well, I have a few stories just alike, and I've been lucky enough to get introduced to this technology. And I actually never saw the technology before I got involved. Dave is Dr. Pascal is a good friend of mine, and he called me up and said, "Hey, man, you got to check this thing out." And I'm well aware of the things he's able to do in his practice, and so I said, "Okay, sign me up. Let me figure out how to do this." So I got myself a bunch of wands, and they came into the practice, and I started using them. And much like everyone else who's been on the phone, we tend to deal with some more complicated cases, and I think like a lot of us do, we tend to go to our most complicated cases, the ones we're stuck with. And the story that I've told many times over, but it's still my favorite story, is I have a gentleman who has been under my care for a while, and his major problematic things was he was actually physically struck by lightning. And amongst that, it just basically fried his nervous system, as you could imagine. When his family first called me and said, is there anything you think you could do? My answer was, I'm not sure. I've never seen anyone who's been struck by lightning. I said, well, bring him in and let's take a look. And he was really not moving very well. He was basically bedridden. And through a lot of the care, he's been up and moving around. But the one thing that I could never change for him was he just gets this unbelievable burning sensation in his hands. And to the point that when you touch them, they feel like they're on fire. You touch his wrists, and they're cold. You touch his hands, and they are burning. And it was just something that no matter what we did, didn't work. So when I first got the wand, he was the first person I saw with it on a Monday. And I looked at him, I said, do you trust me? He says, yeah, absolutely. And I said, well, I want to try something different. And I just took some time to run through the protocols, and I wanded his hand. And that night he text messaged me saying that was as good as his hands felt since before he actually got struck by the lightning. It's the only thing, and still to this point, it's the only thing that's ever gotten him relief with the power of the wand, and just with it simply wanding it over his hands. And he kept saying to me, are you touching me? Because he had his eyes closed. Are you touching me? Are you pricking me with something? And I said, no, why? He said, well, I could feel my hands like tingling, almost like you're pricking me with a little bit of a needle. And it was just all of that sensation normalizing right there in his spot as I was wanding him. And still to this day, his hands feel pretty darn good. And it's a great thing because he's an artist, and when he's bedridden, he's doing most of his things with that. But now he's up and moving around. He's able to use his cane without fear of falling as we get him up and getting him more mobile. So that was the first experience. That was kind of a wow, eye-opening thing. I said, geez, if we're going to do this, let's do this and jump in with both feet. And it was just an amazing thing. So we just used it. Getting patients off of medications, we find that they get off medications in like half of the time. When you're doing this, you're trying to move these people with chronic pain and these long-standing issues and injuries. I have a 83-year-old patient with Parkinson's that came into my practice, and she would put her hands out and she would tremor, and I would literally take the wand out, and as I was explaining to them what the wand was, I would do it around her hand, and as I would do it around her arm would stop shaking. And then I would stop doing it, and her arm would start shaking again. And I would do it again, and it would stop shaking, and then I would do it again. I said, well, this will amplify the treatments that we do. After one treatment, and we did the wanding along with that as well, too, her trembles, her intention tremors stopped by about 80%. And I'm very happy to tell you that this gal basically went, and 83 years old, so it's not like we're talking about 20-year-old here. 83 years old, she went out and told everyone in her neighborhood, and I got a slew of referrals based off of that. And then the last one always, we talk about how nice it is for patient care. Well, last night, it was Halloween, and I got a 19-month-old little bruiser baby boy, and he was running around, and I was chasing after him, and I grabbed onto him because I was afraid he was going to fall, and I kind of caught him in an awkward position, and I had hurt my middle back years ago playing sports, and I just felt it pop, and oh my, did that hurt. And I knew I was in trouble, and every once in a bit I do this, and I know I got to go get adjusted for about a week straight every day before I get out of it. But the worst part of it is Sunday night. I didn't want to bother my chiropractor buddy in town, so I just said, well, let me just deal with this, and then tomorrow I'm just going to be in pain until lunchtime. I get ready to go and get over there and see him. But I was adjusting patients all day. I got to go through, and I was like, you know what? Let me get the wand. I got the wand out. I was wanding myself for a little bit. And I tell you, I went through all day of patients today, out any pain, zero pain, no problems. I went straight through, and now I went and got adjusted because nothing fixes everything, and there was still something I needed to do. So don't worry about the fact it's going to change your practice like that, or people aren't going to need you. Because I understood that I still needed to get fixed, and if you educate your patients, they will